Dr. Alfred Marquez here with a series today that pertains to diabetes. And if you know someone that has diabetes, if you yourself have diabetes, if you suspect you have diabetes, it's a lot of people. You should look at this series and you might learn something. And today we're fortunate to have Sandra Gonzalez. She's the executive director of the El Paso Diabetes Association. And very different. This is a local organization that pertains to El Paso and the region, very different from the National Diabetes Association. So we're going to have a discussion and tell us, first of all, how prominent is diabetes here in the El Paso area and the region?
Here in El Paso, it's 1 out of 7 with diabetes. So it's really, really high. It's almost 14% of our population that have diabetes. Or let me tell you in other words, it's 84 million people that have pre-diabetes and don't even know it. It is so sad that people don't want to get tested because they're afraid. It's a little tiny, little poke. It takes seconds to get tested for diabetes. If anyone that wants to get tested could just come to our office and get tested for free. That way, if they get diagnosed at pre-diabetes or diabetes, they get to know how to manage it. People that get diagnosed with diabetes feel like their whole life is over.
Right.
But they could get it managed if they follow the right diet, exercise, and everything. So that is one of the things that we do at El Paso Diabetes. We take the classes, we teach you how to manage your diabetes. And if you're at pre-diabetes, we teach you how to stay at pre-diabetes, not to go to diabetes. You could always stay there.
So let me mention something. El Paso, in comparison to other places in the country, are we not one of the leaders, if not the leader?
Yes, we are.
That's a sad thing to be number one, but
It
we
is.
are.
Mm-hmm.
Okay,
We are.
so here's the deal, and I have to admit my ignorance because I didn't realize what El Paso Diabetes Association was. I really didn't.
I know.
I didn't, but you know, you've shown me what you do, and I'm really amazed. And we have so many people that have diabetes and need help every single day.
Mm-hmm.
Patients that come in, I see, and what amazes me is they really don't understand what diabetes is, and they don't know how to manage and treat it. But that's where you guys come into play.
And also a lot of people that even they tell them, you're at pre-diabetes, and they think about it, I'm okay, I'm not feeling sick,
Yeah.
I'm okay, I'm not going to worry about it. They don't go and take care of it till it's late. That's our people that think about it. You know, why am I going to go to the doctor? I feel okay. They said I'm pre-diabetes. I'm not diabetes. Once you are pre-diabetes, you do have diabetes. And one of the biggest things that I want to say, we could stay at pre-diabetes. Don't go to diabetes. People do not die of diabetes. People die of diabetes complications. Once you have diabetes, all the other complications come along. Dialysis, heart attacks, lungs, everything else comes along with it.
So these are reasons why if I have diabetes, I should be concerned, because it's life-threatening.
It is life-threatening. This is a disease that is so horrible. If people would just get diagnosed early or get tested, if you're going to the bathroom a lot, you're urinating a lot, you're falling asleep, or if people in your family have diabetes, come get checked. It's 3 seconds that get checked, and it's free. We give that test for free at our office. We are a local nonprofit, just like you said. We're here to serve our community. And one of the sad thing is, it's either you're going to come to us or you're going to go to UMC. There's not very many places here in our community that you're going to be able to go and get help. So come get tested. It's not going to take a long time. come get checked and find out if we can help you. If you are tested there, we will put you in a class. We'll ask you what do you feel. Not only can you come to the class, we have support groups. We also have our cooking class so you could learn how to cook healthy. We also have our type 1 support group. We have our type 2 support group. So there's just so much that we have to offer that we could teach you. One of the things that you go to the doctor and they give you a whole list and you're diagnosed with diabetes and it's the first time and you're like, oh my God, now I have to do insulin. What is the insulin? How do I do the pen? And they give you all this and you don't know how.
You got to figure it out.
Yes, and the doctor's talking to you in that language and you're like, I don't know what he said, but I'll just shake my head and I'll figure it out. If you're diagnosed and you are given insulin or a pen and you don't understand, come to us. We have an RN that is certified on diabetes, a CDE. We also have a dietitian that is certified on diabetes that could teach you and educate you how to do all that.
So diabetes affects all ages.
All ages.
All
It
ages.
does not discriminate.
And we have, can you help us understand a little bit the difference between type 1 and type 2 diabetes and what the difference is?
Type 1, you will be diagnosed at a earlier age before 21, and type 2 is on a later age. Type 1 could be hereditary. It could be because your pancreas is not working correct or some, but type 2 will be on the later age. And a lot of people have a misunderstanding. People think just because you're big and heavy, you're going to have diabetes. Let me tell you, that's not true. I personally have a friend that is like, I would say 120 pounds that was diagnosed with type 2 diabetes. And she's healthy, though it was hereditary from her family. So it's a don't think just because you're heavy or just people that are heavy are going to be the people that have diabetes. Diabetes does not discriminate at any age, anytime, at any place.
So all ages can be affected, and you don't necessarily have to be taking insulin or and a lot of people have this conception of, well, it's only my blood sugar that's going up or down, or that's what diabetes is, but it's much deeper than that. The blood sugar is nothing more than a symptom. Correct?
That is correct.
Okay.
But after your sugar goes up and down, guess what? What's going to be affected then? You're making your pancreas work harder. So what's going to be next? You're not going to go to urine dialysis till your kidney goes out? You get clogged arteries? No. That's the biggest thing that we tell people. Don't wait till you're there. If you don't feel bad, but you know you have diabetes, go take care of it. Don't wait till you're at the end of it and it's a little bit too late.
Yeah.
Not only one of the things I would tell you, it's not only that, it's your hearing, also, and your vision. And I will tell you, because I personally my dad lost his hearing through diabetes. His sugar was so high that he lost his hearing through diabetes. So that's what I'm saying. Don't wait. Don't be that person that waits till the end to go. And I'll say he was just like everybody I'm saying. Didn't feel sick, didn't go to the doctor. His sugar was like at 600. Drove himself to the hospital, and guess what? It was so much higher by the time he got there and they checked him that he lost his hearing. Don't wait till then. That's a little bit too much. Do it before. Because if he would have taken care of it, if I would have known more, I would have been able to help him more.
So I'm a patient with diabetes, and I like what I'm hearing. And I say, okay, I want to go see you. And maybe my doctor has, or maybe my doctor has not told me about your organization. What should I do so I can get help from you?
They could always call our office at 532-6280 and make an appointment for any of our classes or an assessment to be able to see our dietitian or RN. But you could also ask, we do have a lot of partnership with doctors. Ask your doctors to send a referral, to
Yeah.
send it to us. Ask them, can you send me to go see El Paso Diabetes? I want to get educated on how to help myself. If we could just have more of us to educate our community, and that's what it is. We want to have more of El Paso Diabetes or more community partners to help us able to educate our community.
Right.
Because that's the only way we're able to help everyone.
Because education empowers us to
Help each
to
other.
help each other. And so help is available. We just have to go out and get it and realize how critically important it is to control diabetes, especially in this region, especially in this community, because it's so rampant.
It is.
It is so
I don't
rampant.
want you to be with that person that's 1 out of 7. Don't be there. Let's take care of it early so we could learn how to manage it. If we take care of it early, we won't be that 1 out of 7. So
Very
if you
good.
think about it, if you're right now in a room and you're 7, if you count 1, 2, 3, 4, 5, 6, 7, that 7 person would be diabetes. How many of us right now would say, do you know somebody with diabetes? Everybody would raise their hand, because I'm sure everybody knows somebody with diabetes or pre-diabetes in their family, or a friend or a coworker.
So just think about it, like going to the movies and the theater is full and each row has about, I don't know what, maybe about 15 people. In each one of those rows there's 2 diabetics.
Mm-hmm. 2 people with diabetes. So can you
2
imagine
people with diabetes,
how,
I'm sorry.
how many people would you count there? It's amazing.
It's amazing.
It's not.
It's amazing.
It's so hurting. That's why we always tell you there is help, there's services that could help you. Please call us, come to our office, call our number at 532-6280, and we would love to help you. If you don't get a referral from your doctor, we'll help you. But if you go to your doctor and they're asking you, and I'll use a story that just happened to us. There was a person that called me and said, I've been going to the eye doctor, and every time I go, he tells me, do I have diabetes? I don't know. I tell him, I don't know. And I said, well, does he test? He goes, no, but I don't know. He goes, where can I get tested? I said, come with us and we'll get you tested. Well, he ended up having diabetes. He goes, and that's why he was having problems with his vision. And the good thing that he took, goes, but why did I wait so long? He was mad at himself because he said, why did I wait so long to come? And for the past 3 years, my eye doctor has been asking me, do I have diabetes? It took him that long, and I wish it wouldn't have, because I'm hoping that we could have caught it at pre-diabetes.
But at least he's doing
Now
something
he's-
about
yes.
it, so hopefully he'll be okay. So again, if I think what we're going to do is we'll be able to put your number and that, and people can contact the El Paso Diabetes Association. If you suspect that you may have it, if you know somebody that has it, if you want to help them, give them a call. And I'm really very pleased to have met Sandra, and I respect what you're doing. And I realize that you have a big job ahead of you. And so I'm excited. Again, I'm embarrassed that I barely realized that what El Paso Diabetes Association is all about, but better late than never, right?
Yes,
So
we're excited to have you on board.
So thank you, Sandra. And once again, if you need help, feel free to give her a call. Thank you.